Yesterday was World Blood Donor Day, and the city held events to mark the occasion. But China still has a long way to go to convince more volunteers to donate. While China has about 20% of the world's population, it only accounts for 10% of blood donations. The city's blood administration office says voluntary donations have risen from less than 40,000 liters in 1998 to 92,000 liters last year, but that number still lacks demand.
On the surface, Shanghai looks glamorous, with bright lights and new malls. But underneath that image is a quiet question. When someone needs blood, will there be enough? In Shanghai, the answer is usually yes, while many other regions of China still struggle with blood shortages and emergency appeals. As the founder of Bloodline at my school, I want to know why this one city often has enough, even a surplus, when the rest of the country does not. Recent data shows that Shanghai collects around 447,000 units of blood in 2024, against the need of 800,000 units annually, while the national blood donation rate is only 11.4 per 1,000, which is in contrast with the United Nations recommended amount of 30 per 1,000, which hints at a market failure.
In microeconomics, blood donation is a positive externality in production. Donors are the producers of blood donations. They face private costs, time, discomfort, travel, but generate external social benefits, lives saved, public health, workforce productivity that they cannot capture. Because donors do not receive these social benefits, they only consider their private costs when deciding whether to donate. This means that the MSC is less than the MPC. Society's net cost of each donation is lower than the donor's private cost. Without government intervention, the market equilibrium is at QM, where MPC meets demand. This is below the socially optimum quantity, QOPT, where MSC meets demand. The deadweight loss is the triangle between QM and QOPT, representing preventable surgeries and lives not helped.
How easy or difficult is it for you to get to a blood donation site in terms of like location or opening hours or waiting time? Like, how was your experience with that?
I think that's a little bit more challenging, right? So I think the great thing about the Bloodline drives was that they brought the blood vans to us, and it just made it really convenient. But if I had to seek it out myself, like even though I do speak Chinese, right, navigating the system here can be quite difficult, and I live kind of far from like the city as well. So trying to go like an hour to, let's say, a hospital or downtown or something, I think just those small obstacles makes it less likely for me to actually do that.
Shanghai's local policies try to push quantity from QM toward QOPT by lowering donors' private costs, shifting MPC to the right, and increasing private benefits, shifting demand to the right. Priority transfusion rights and benefits for donors and their families increase the expected private benefits of donating, effectively shifting the demand curve to the right. Mobile donation buses and campus drives cut travel and waiting time, lowering the MPC curve rightward, so the new equilibrium quantity moves right. Digital and WeChat systems make information about when and where to donate clear, reducing asymmetric information and lowering the non-monetary costs that keep willing donors at QM. Together, these acts like a Pigouvian subsidy for donating. The new equilibrium Q1 lies between QM and QOPT, and the deadweight loss triangle becomes smaller. After these policies were expanded, donations in Shanghai increased by approximately 5.9%, evidence that the MPC curve shift down.
Of course, Shanghai government has always these incentives indirectly. For instance, like I said, if you donated blood, you have priority if you or your immediate family needed blood. And therefore, but people don't really donate blood for that, I believe,
Yeah.
But obviously that comes with a perk. Also, in the past, I've known where after you donate blood, you had a special access to a free coffee at the airport or public space and so on. But yes, the government policy is geared around social credits now. So if you can donate blood when you can, you are given a social credit, and not only that, there is incentives in terms of awards. You attended this even the other day where you saw people donated platelets 400 times, 500 times, 600 times. So yes, it was a very strong participation.
Policy sets the frame, but groups like Bloodline decides what actually happens at the school level. Many students tell me they want to donate and are not sure if it's safe, how long it takes, or when the drive happens. And this is a clear case of asymmetric information that holds back on blood donations. And this is also the case for parents and teachers. By giving simple answers, posting clear times and locations, and running drives on the school campus where people can come donate with their friends and families, we reduce the information gap and lower the non-monetary cost of donating. At our last event, we had approximately 32 donors come and collected around 9.8 liters of blood, which shows how a single school can turn an uncertain maybe donors into actual donors. I decided to start Bloodline because I wanted to pursue a career in the medical world. And when I was reading an article, doing some research, I came upon an article that discussed the blood shortage in China, and that got me extremely fascinated, which is why I reached out to Dr. Maske, who is the founder of Bloodline, the external parent organization. And when I implemented into SAS, I realized a lot of people didn't realize that China and many countries in this world were affected by a blood supply shortage, and that people didn't experience this firsthand and couldn't comprehend the magnitude of this issue. I think before Bloodline.Y existed at our school, not many people were inclined to donate blood, specifically because of the inconvenience, because China already, or Shanghai has a lot of mobile units, but they aren't in the most accessible areas for us because we are in a rather far away place from the main city itself. And going to Shanghai Blood Center would take half an hour to donate blood. So a lot of donors who previously told me they want to donate but didn't donate before, mainly was because of the location and the convenience issue. In our most recent drive, we had 32 donors show up. In our first donation, we had 21 donors show up. So we went from a scale of 5 liters to 9.8 liters within half a year. I think specifically in our school, when we do our promotion campaigns, we like to emphasize a lot on the blood donation benefits and the statistical facts on why we need to donate blood. And I think telling people that there's a lot of health benefits to donating blood for the donors, as well as additional medical benefits like priority access to blood and having to waiver these medical fees during an operation for yourself and a loved one, greatly incentivizes people and makes people want even more to do so. But I think people who donate blood already have this kind of incentive to help the community. It's just that these extra incentives that I've mentioned are just bonuses.
So I've only done it twice, but it was so easy and good through Bloodline. I plan to do it anytime it's available on campus. I have no idea where any of those things are. And so I think having something like Bloodline where the donation center comes to you is revolutionary, and it makes life so much easier, especially when you can go to a place like SAS where you have hundreds of potential donors and you bring it to their doorstep. It really removes the barriers to donating. It's the fact that there was a mobile donation center that was able to come to me that really pushed it. Well, I think also, the messaging that Bloodline did. So that's not really related to Shanghai government policies. I think my behavior was more shaped by the advertising that Bloodline did, but as well as the convenience. And so the convenience, I think, was facilitated by the government policies.
These changes help explain why Shanghai now collects around 447,000 units, while some provinces still report shortages. In a simple supply and demand diagram, for blood services, a higher quantity that matches hospital needs increases total surplus and shrinks the deadweight loss that comes from too few donations. But if Shanghai collects more than hospitals can use before blood expires, those extra units do not add to surplus, and the resources used to collect them are partly wasted, which is not allocatively efficient. Income inequality helps explain why Shanghai can reach an enough or surplus position while many rural areas still face shortages. China's Gini coefficient is around 0.46, showing a large gap between richer and poorer regions. A richer city like Shanghai can afford campaigns, good labs, and digital tools, while poorer inland areas that only reach a small amount of people and donation rates lack those resources and remain stuck with low supply and higher debt weight loss. The key question is what other regions can learn from this. High-income cities with dense populations and good digital systems can adopt similar priority rights, mobile units and online platforms to shift MPC down, moving their equilibrium closer to Q socially optimal and reducing debt weight loss. Lower income areas may need to start with safer collection, basic education, and trust building before they can fully copy Shanghai's model. From inside one school club, I can see that when government policy and community action line up, the quantity of blood moves closer to the socially optimal level and the market failure becomes smaller.
My closing thought is that what we're doing at our school is part of an even larger system. When a city like Shanghai designs effective blood donation policies and schools like ours translate these policies into real people showing up to donate, the entire system becomes more reliable and more efficient. We are only one school, but every time a student or teacher donates, it makes having enough blood, safe blood, a little bit more normal than a city rather than having something uncertain. If more schools and more cities across China can build the same kind of partnership, then a stable blood supply will not only be dependent on the luck or last-minute appeals, it will simply be expected outcome of a well-designed system.